So for today's presentation, we chose type 2 diabetes for our special topic. In our group, we got our leader, Carla, we got Matt, Tyler, and Jasmine, as well as Eric. And these are the slides that we'll be going through today. And now on to Jasmine.
So a little bit background on the type 2 diabetes. About 1 in 10 Americans are diagnosed with diabetes, and roughly 95% of that is type 2. And it's developed in more with people with ages of 45. And it starts to show as the years are going with young teens, children, and even young adults. So there's a lot of red flags right there. And the cause of type 2 diabetes is when um, the body the body becomes resistant to insulin, or when um, the pancreas is unable to produce enough insulin. And a lot of factors contributing to type 2 diabetes is that it can also be genetic, so runs in the family, mom, dad, grandparents, aunties, all that stuff. Also, if you're overweight or inactive.
There are several comorbidities associated with type 2 diabetes. Comorbidities are diseases that are or that have the propensity of coexisting with another disease, such as hypertension and diabetes, and that being one of the most common, with about 82% of the diabetic population being hypertensive. A key distinction to be made, though, is that comorbidities are not symptoms. One can be hypertensive and not have diabetes. It is simply that relationship of both diseases. It is that coexistence of the diseases being in the human body. About 90%, 98% of the American population with type 2 diabetes has at least one of these comorbid conditions, but at least. And the most alarming statistic, I would think, is nearly 90% of the diabetic population has two or more of these comorbid conditions. Obesity is the second most common, with 78% of the diabetic population, with dyslipidemia falling short at 77%, CKD or chronic kidney disease with 24%, and cardiovascular disease with about 21 to 22%. Moving on to limitations and benefits of exercise. Truly, the limitations of exercise come from symptoms of diabetes, such as increased thirst, irritability, and fatigue. Much of this would bring uncomfortability and may discourage the partake of the activities. But as for benefits, really the whole right side should be jam-packed full of ways that exercise can benefit one and just the general population. Uh, Through exercise, I can maintenance the body in very facilitated. Simple flexibility exercises can help with the range of motion. Regular physical activity results in better insulin action, and there's higher muscle capillary density, oxidative capacity, lipid metabolism, and also an increased signaling insulin of proteins. Um, Aerobic exercise not only aids in the cardiorespiratory fitness, but it also increases muscle insulin sensitivity. All in all, regardless of pre-existing conditions, exercise reaps a lot of these benefits.
Before beginning exercise testing, participants should be screened. Health screening is used to identify any potential need for medical clearance prior to testing. A common form that's used is a physical activity readiness questionnaire, or PARQ. PARQ consists of a short series of questions regarding the health of the person being screened. If they answer yes to one or more questions, it denotes that they may need medical clearance before testing can begin. In this case, we might see someone with type 2 diabetes not answer any questions yes on the PARQ. So there are some American College of Sports Medicine, or ACSM, has expanded guidelines to supplement the PARQ. So if you'll see right here, if this individual does not participate in exercise or if they're sedentary and they have no cardiovascular, metabolic, or renal disease, or no signs and symptoms, no medical clearance is necessary. Medical clearance would be recommended for a sedentary individual if they have a known CV, metabolic, or renal disease. Type 2 diabetes would be considered metabolic, so in this case, they would need medical clearance, or if they have any signs and symptoms of it. If the person already participates in exercise, in the case of a type 2 diabetic, if it's moderate or light intensity, there is no need for medical clearance. If this individual would want to progress into vigorous intensity exercise, then they would need to see someone to get clearance for that. If someone is not known to have type 2 diabetes, but they are showing signs and symptoms of it, it's recommended that they discontinue exercise immediately and seek medical clearance. There's a lot of reasons that people can do exercise testing. One major one would be to determine aerobic fitness. This is usually measured as VO2 max. The reason for this measurement is that aerobic fitness is an independent predictor of coronary heart disease. In fact, exercise stress testing can serve to diagnose heart disease in individuals. Another reason would be that aerobic fitness is relative to someone's performance in physical activity. So what this allows us to do is we can collect baseline and follow-up data that will help participants and trainers to monitor and evaluate their progress. They can see how they're getting better. Maybe they're not getting better and they need to change things up. And it helps with establishing goals and motivating the participant. So now we're going to move on to Tyler, who's going to talk about what a typical test would look like.
Thank you, Matt. Hello, everybody. My name is Tyler Harris. The portions of the presentation that I will be going over are special considerations prior to and during testing for a type 2 diabetic client, along with what a typical exercise test for these individuals will look like. Beginning with considerations. First of all, we need to determine the goal of the client. Like Matt said earlier, those clients seeking to participate in light to moderate exercise do not actually need any clinical testing clearance prior to exercise testing. Additionally, we need to consider sedentariness. Along with sedentariness, if a client presents with chest pain during routine physical activity, their physician will more than likely require an ECG stress test prior to exercise. Like Matt stated in the pre-exercise screening, if the client presents with any other risk factors or any other symptoms, maximal testing will be required. We also need to consider the medications that the client is taking. These medications can alter the test results. Additionally, more importantly, these medications can impact hypoglycemic incidence during the test. Physicians will need to monitor this, so maximal testing is also required. Moving on to what a typical test will look like. Depending on presenting comorbidities and other risk factors, the test might look exactly the same as an undiagnosed client. For cardiorespiratory testing or aerobic testing, we need to determine the overall goal once again. Submaximal testing in a non-vigorous form, such as the STEP test, may be adequate in those patients seeking to only participate in light to moderate testing. Clients that would need maximal testing, associated risk factors would be high sedentariness, clients presenting with additional comorbidities and other associated risk factors, and additionally, those seeking to participate in a vigorous exercise plan. As far as muscular fitness testing goes, this is great and it is a key tool for establishing exercise prescription. This will establish a baseline for participants and clients that don't have a lot of experience in resistance training. We also need to consider sedentariness here. These clients might not have a whole lot of experience, so we need to consider the use of machines and also consider the use of non-1 rep max testing and use the estimation chart instead. Aerobic testing, we need to consider the potential for a hypoglycemic incident during muscular endurance testing. We should probably leave this to the professionals in the clinic. Overall, type 2 diabetics probably aren't going to be coming to exercise professionals to participate in powerlifting exercise. goal here is to stay active. And tests like these can be key in determining exercise prescription. Thank you for your time, and Nick will take it over from here.
I will be going over how exercise prescription will be different for people with type 2 diabetes. So it is recommended for people to do a moderate aerobic exercise for about 150 minutes, 3 to 5 days per week. Aerobic exercise is best because it can increase insulin sensitivity, decrease insulin resistance, and lower blood sugar, which is good. And there's also a lot of resistance workouts best for people with type 2 diabetes, but the people who are sedentary, it is important to keep note that they need to start slow and not rush into intense or vigorous exercise, because there is a big risk of, for example, like what Tyler said, they can experience chest pains if they work too hard. So their body needs to be more physically prepared for this level of exercise. And so Carla will bring us to some of the examples of different types of exercises.
So for my section, I will be talking about different types of workouts recommended for the type 2 diabetes patients. So for research done by the Research Center of Sports Science in the University of Trás-Montes in Portugal, they analyzed and synthesized the guidelines of exercise prescription for patients with type 2 diabetes. So all these organizations are from the American College of Sports Medicine, the American Diabetes Association, Belgium Physical Therapy Association, the Francophone Diabetes Association, as well as the Canadian and the Swiss International Institution of Public Health, and lastly, the American Heart Association. So in the charts, you can see that for the American College Sports Medicine, and the American Diabetes Association, they recommend 3 types of trainings, which is aerobic, resistance, and flexibility. For type 2 diabetes patients, you can see that the duration for aerobic is a minimum of 150 minutes a week with intensity of moderate to vigorous. So their frequency would only be 3 days a week for no more than 2 days. For the resistance, you can see that again, it's moderate to vigorous, and it's only twice a week, non-consecutive. And for flexibility, they want it to be any exercises that will complement any other type of exercise. For example, if you compare the recommendations from the American College of Sports Medicine to the Belgium Physical Therapy Association, you can see that they only prescribe 2 types of trainings, only aerobic and resistance. Same duration for aerobic, but because it is for the intensity different, low to moderate, they recommend it 3 to 5 days instead of just 3 days. For the resistance training as well, it is moderate, so they will be more, you will do more because it is a lower intensity. You could also compare it differently to the Swiss National Institution of Public Health. They do aerobic and resistance training only as well. Yet, depending if it's vigorous or moderate, they recommend it to be, if it's moderate, daily, or if it's vigorous, 3 to 5 days, as well as resistance. It's different training program that they recommend. These are all different organizations throughout the world that recommend this for type 2 diabetes patients. As a result, you can kind of, well, in conclusion, you could tell that the recommendation for aerobic exercise is at least 150 minutes a week, moderate to vigorous intensity, resistance training to be 2 days a week, flexibility trainings to complement other types of exercises, as well as for all of the guidelines, you can see that combining resistance and aerobic training benefit the most for type 2 diabetes patients. Lastly, other considerations for exercise prescription that we have to include is that these guidelines are not for everyone. The workouts are made for the specific individual, and any contra indications that they may have, as well as personal goals, depending on the individual's personal goals, is how the prescribed exercise intensities and frequencies change throughout. And lastly, any medical conditions other than type 2 diabetes that they may have. And this will conclude our presentation for type 2 diabetes.